A group of public health experts and doctors had a chance to directly ask Pfizer questions about its proposed COVID-19 vaccine. Reveal investigator Andy Perotti breaks down the highlights.
The meeting was run by the Centers for Disease Control and Prevention. It has an advisory group made up of public health officials and medical experts throughout the country to help the agency develop recommendations about vaccines. Here are some of the main takeaways from the virtual presentation today. A doctor who works at Pfizer spent several hours presenting and then taking questions. We learned that the vast majority of the vaccine trial participants were white. Take a look at these numbers. 35,000 white participants compared to just 4,100 blacks. While the effectiveness of the vaccine, about 95%, is still essentially the same for all races, the low black participation likely demonstrates the challenges with vaccine trust and hesitancy in black communities. Less than 1% of the patients who received the vaccine experienced side effects, which were mostly temporary, minor to mild flu-like symptoms. 23 women who received the vaccine during the original vaccine trial became pregnant, and so far, none of them have experienced any adverse effects. We also learned that 2 women who received the vaccine this week in the United Kingdom were briefly hospitalized after an allergic reaction. And that reaction happened within just minutes of getting the shot, not days. The advisory group plans to meet over the weekend, and it does not know what their recommendations could be or even whether they could impact the FDA's decision to approve Pfizer's vaccine. Earlier today, the Georgia Department of Public Health held a virtual meeting with hundreds of people in the long-term care facility industry. We'll let you know how that meeting went, new at 6.